10 High blood sugar warning signs you shouldn't ignore. Although you might assume that any indicators of high blood sugar would be visible, it is perfectly possible for them to go unnoticed. You most certainly aren't alone if you are unaware that you have high blood sugar, because many individuals are. According to the Centers for Disease Control and Prevention, more than 34 million Americans have diabetes as of 2018. Diabetes is a condition that develops when your blood sugar levels are too high, either because of insulin resistance, in the case of type 2 diabetes, or as a result of your pancreas not producing any or enough insulin, in the case of type 1 diabetes, CDC. However, according to the CDC, 21% of adults with diabetes are ignorant of their condition. In addition, 88 million Americans, or more than 1 in 3 adults, live in the country. Only 15% of adults with the condition indicated that a doctor had given them a diagnosis of the disease, according to the CDC. Prediabetes is a condition when blood sugar levels are higher than usual but not high enough to be referred to as diabetes. High blood sugar, what is it? An accumulation of extra glucose brought the condition of hyperglycemia, often known as high blood sugar, in the blood. Those with diabetes are more likely to be concerned about this than those without the disease. But high blood sugar can occur in specific circumstances, such as when a person has diabetes. A fasting blood sugar of more than 125 mg per deciliter is regarded as hyperglycemic, according to the clinic. Blood sugar, commonly known as blood glucose, is measured in milligrams per deciliter, milligram per deciliter. According to the clinic, a person may also be diagnosed with hyperglycemia if their blood glucose level is greater than 180 mg per deciliter 1 to 2 hours after eating. Optimal blood sugar. The pancreas normally secretes just the proper quantity of insulin, the hormone your body needs to assist transfer glucose from the bloodstream into the body's cells for energy usage or storage, the NIDDK adds. This happens when the glucose that comes from the food we eat enters the bloodstream. This maintains a rather narrow range for blood glucose levels. A person who is capable of controlling blood sugar levels should never experience substantial hyperglycemia. According to the American Diabetes Association, a fasting blood sugar level of less than 100 mg per deciliter is considered normal in people without diabetes, ADA. Reduced blood sugar. According to the National Institutes of Health, low blood sugar, also referred to as hypoglycemia, occurs when your blood sugar level dips below normal, NIH. According to the clinic, low blood sugar is typically indicated by a fasting blood sugar of 70 mg per deciliter or less. Causes of high blood sugar. You would believe that eating really sweet food is all it takes to cause hyperglycemia, but it's not quite that straightforward. Yes, eating a lot of sugar or carbohydrates can cause your blood sugar to rise, but at that point, your pancreas usually gets to work producing insulin to transport the glucose to your body's cells. High blood sugar warning signs. Anyone who has been given a diabetes diagnosis will be familiar with how hyperglycemia feels. If you have diabetes, you can also monitor it by testing your blood sugar frequently. However, being aware of the symptoms of high blood sugar could encourage the millions of individuals who have diabetes or prediabetes but are unaware of it to seek medical attention and receive a diagnosis as soon as possible. The NIDDK explains that while type 1 diabetes symptoms might appear quickly and severely, type 2 diabetes symptoms can develop gradually and be so mild as to be undetectable. According to the NIDDK, the majority of persons with prediabetes really have no symptoms. Therefore, the NIDDK advises to get checked if you have risk factors such as family history, being overweight, or being over 45. Even so, it doesn't harm to be aware of the numerous short and long-term indicators of high blood sugar, especially if your risk is increased. Early on, hyperglycemia can cause a range of symptoms, including 1. Tiredness is a thing. According to experienced doctors, feeling exhausted may be the most typical early indication of high blood sugar. The doctors add that it's also one that can happen, to a minor extent, with even the typical, mild blood sugar swings that occur in persons without diabetes, or with prediabetes, when they ingest a lot of simple carbs like sugar. Of course, fatigue is a somewhat vague sign of low blood sugar. But if you frequently experience exhaustion soon after meals, particularly those high in carbohydrates, it can be related to your blood sugar levels. People frequently express their want to snooze following lunch or their inability to open their eyes after dinner after consuming large quantities of pasta, potatoes, or sweets, according to experienced doctors. It should be made clear that eating these meals is completely okay. But if you discover that they consistently cause you to feel a particular manner that worries you, like being abnormally tired, it may be an indication that you should speak with a doctor. 2. Often urinating. Your kidneys start trying to pour out more sugar to get rid of it when your blood sugar level is too high, and they draw out water along with the sugar as they excrete it. According to doctors, you end up using the restroom more frequently as a result. 3. A rise in thirst. A panel of doctors explained that this is a natural consequence of peeing more since your body becomes dehydrated. The doctor claims that people felt thirsty all the time. According to the clinic, dehydration also starts to cycle. The more you urinate, the more thirsty you become, the more you drink, the more you urinate, and so on. 4. Migraines are bad. According to a panel of doctors, headaches can be brought on by dehydration of any kind. Of course, headaches can indicate a wide range of conditions, but if they are new or present in conjunction with other symptoms, it may be worthwhile to seek medical attention. The dehydration, aside from making your headaches worse, can also make you feel more tired. 5. Cloudy vision. The clinic states that when there is too much sugar in the blood, it can have an unanticipated impact on the eyes and other parts of the body. According to doctors, it actually caused the fuzzy appearance by additional sugar that becomes stuck in the middle of the eye's lens, together with a small amount of water. 6. Disorientation, nausea, and vomiting. The U.S. National Library of Medicine states that despite their varied nature, these symptoms are all indicators of the rare and potentially fatal condition known as diabetic ketoacidosis, DKA. Along with the aforementioned signs and symptoms, DKA can also result in stomach pain, difficulty breathing, dry or flushed skin, fruity-smelling breath, and attention deficit disorder. According to the U.S. National Library of Medicine, it typically affects persons with type 1 diabetes and is occasionally the first indication that they are ill. In type 2 diabetes, DKA can occasionally manifest in a milder form. According to the U.S. National Library of Medicine, DKA develops when the liver is unable to utilize blood sugar for energy in the absence of insulin and starts to break down body fat into a type of fuel called ketones at such a rapid rate that they turn poisonous and cause the blood to become acidic. Anyone experiencing these symptoms should seek medical attention right away because DKA can be fatal if neglected. 7. Continual infections. According to the CDC, persistent hyperglycemia might impair the body's immunological response. Some infections become tougher for your body to fight against as a result, increasing in frequency, duration, or severity. Those with diabetes who have vaginal cavities are likely to experience yeast infections more frequently, according to a panel of doctors. According to the NIDDK, this is because extra sugar from high blood sugar that leaks out through the urine feeds the bacteria that might cause severe illnesses. The CDC states that having diabetes may increase your risk of developing UTIs. 8. Slowly healing wounds. A panel of doctors claims that high blood sugar levels can also have an impact on your body's circulatory system, affecting blood flow in the body's capacity to recover itself. According to the clinic, slow healing sores, frequently on the feet, are a common indication of this poor circulation. 9. Dental problems. Both your saliva and your blood contain glucose. According to the NIDDK, when there is too much of it, it promotes the growth of dangerous bacteria in your mouth, which then combines with food debris to form plaque. Problems including dental decay, cavities, gingivitis, gum disease, and poor breath result from this. One of the first things to watch out for is swollen, painful, or bleeding gums. 10. Ringing in the feet and hands. According to doctors, over time, hyperglycemia can affect nerve function and finally result in neuropathy or damage to the nerves. The most typical type, according to the NIDDK, is peripheral neuropathy. According to the clinic, you may experience tingling, numbness, or burning in your hands, feet, arms, and legs. When to visit a physician. When you should consult a doctor about your worries if you are having one or more of these symptoms to the extent that they lead you to get mentally alarmed or negatively impact your life, for example, because you are too exhausted to go through the day. A specialist, such as a primary care physician, can assist in identifying whether your symptoms are being caused by diabetes or prediabetes-related elevated blood sugar. It is still important to discuss hyperglycemia and other potential reasons for your symptoms with your doctor, even if you are unsure exactly what's happening. Prevention and treatment. Prevention. Depending on the cause and your general health, you can treat and prevent high blood sugar in different ways. But generally speaking, it will almost probably require collaborating with your medical team on a plan incorporating a combination of lifestyle modifications and medicines to help you manage your health the best possible way. If you learned anything from this video, then like this video, and then share this video with your close friends. Please make sure you subscribe to our channel as we will release more great videos in the future.